Shall we begin?
Why not? Welcome to Frankie Sense and More. It's like she's got a whole lot of goodness for you with a little bit of sass.
Frankie, did you just say?
She sure did. Not to mention, along with...
Whoops.
Join us now as Frankie Picasso and her new co-host mix it up with authors, musicians, and interviews with world-changing people.
Let's begin now.
Okay, let's begin now, because it only makes sense.
Well, hello there, and welcome to Frankie Sense and More. It's Thursday, February the 15th, and I am so happy to be here with all of you. Hey, we're here together. Today you're going to meet who I think is absolutely an amazing human being. He is a friend to pets and wildlife alike, and he offers the best in both Western and Eastern medicine when it comes to healthcare for your pets. Dr. Gary Richter is with me today. He was voted America's favorite vet, and he is the author of the Ultimate Pet Health Guide, Breakthrough Nutrition and Integrative Care for Dogs and Cats. Now, let me tell you, he's not only certified as a DVM, but he also got certified in veterinary Western herbal medicine, ultimate hyperbaric medicine, chiropractic medicine, acupuncture, and like just so much more. He's the medical director of the Montclair Veterinary Hospital, as well as the Holistic Veterinary Care. And he offers acupuncture, herbal therapy, medical cannabis consultation, hyperbaric oxygen, chiropractic, as I said, pulse signal therapy, microcurrent therapies, and much, much more. He also, which I just love, is one of the co-founders of the Montclair Veterinary Hospital Pet and Wildlife Fund, which since its inception, this is so exciting, has donated more than $500,000 in medical care and supplies for rescued wildlife. How about that? Welcome. Look at you.
Thank you.
Oh, how exciting. I wanted to be a veterinarian ever since I was like 3 or 4 years old. That was my goal, to be a vet. And then we moved to our family farm, and my dad had promised me a horse, and I got the first calf. And then one day a vet came, and we had a couple of cows that had really long horns, and they weren't very nice cows, and they decided to take those horns off.
Yeah.
And I was there for that operation, let's call it. It was not very pleasant.
No, it's not.
I kind of went, no, I don't think I want to do that. I don't think I want to do that anymore. But it's still my happy place to be like surrounded by animals everywhere.
Sure. That's understandable.
Yeah. So I just love how you are, have developed this integration of Eastern and Western. And so I want to know, where did that come from? Like, when did you get interested in that?
I guess it comes from a number of places. I had some experiences when I was in veterinary school where I had the opportunity to see a very accomplished Chinese medical doctor work on a horse, and really work what could only be described as a medical miracle with this horse. And I think that was probably my first real exposure to something outside of the Western medical field. But after having been a veterinarian for a number of years, what I found was that there was a hard stop, if you will, as far as things that I could do for my patients. If an animal had any given specific diagnosis, there was a certain number of things that I could do with my Western medical education, and after that, there just wasn't anything left. And quite honestly, I just didn't like telling people that they were out of options. So what I did was I started looking for other options, and what I found was that there's a world of medical therapy and very scientifically valid treatment out there that is just not part of the normal Western medical paradigm, and thus it's not taught in veterinary school or human medical school for that matter.
Yeah.
And that was really what led me down the pathway to start to become educated in Chinese medicine and chiropractic and herbal therapy. And now that's all happened, the things that I'm able to treat and the quality of life that I'm able to maintain in my patients is so much better than it ever used to be.
You must be a very curious person.
Oh yeah, I mean, I'm always, I mean, that's what gets me out of bed in the morning is really just, just trying to figure out how I can always do a better job, how I can improve. I mean, it's one of the great things about being a doctor and practicing medicine is this is not a profession that you could ever possibly master. There's always more to learn. There's always more to do.
Yeah, I think that's the problem right now in a lot of healthcare, for the humanoid and animal is a lack of curiosity, because they do tend to stop and they just go, well, that's all, that's it. There's no curiosity about, well, why do they have that? Let's work on this a little bit more and see what we
Sure.
can come up with, or just, not being open to other therapies, which is
Hmm.
very sad, I think, for a lot of doctors and for, people. One of the things I'm sure that people want to know is end of life. So how do you know when it's time to say goodbye to your pet? Even, quality of life and all of that. I had a German Shepherd, beautiful dog, got diabetes. I gave him insulin twice a day. He was
Hmm.
blind and he was okay with the blindness. And I think when he started, his bowels started going in the house, that got a little bit upsetting for him.
Sure.
And my vet had said to me, you probably kept him a year longer than other people would have. Not that,
Hmm.
I don't know if that was a compliment or not, but you know, I'm very sensitive to the fact that I wanted him. Did he want to stay? I think, I got the timing right when he was about to go. But a lot
Yeah.
of people, is it too soon, too late? How do you know?
Yeah, that's maybe one of the most difficult decisions that pet owners ultimately wind up having to make, and obviously it's all a very very individual sort of decision. But the way that I normally sort of talk with people about this is really it's a quality of life assessment. So it's looking at the dog or the cat or whatever animal it may be, and really kind of looking at what are the things that they've done in their life that have been fun for them, that have given them enjoyment, and compare that to where we are now. So what are they doing now? Are they still able to do any of that, or are they at a point now where they're just really just sort of like sleeping and eating and existing? Um, and couple that with, do we have a reasonable suspicion that they're in pain, that they're in discomfort? And then lastly, and I think this is the trickiest sort of philosophical question that people need to consider, is because we do have this option with animals that we can euthanize them, that we can give them a soft landing, if you will, rather than sort of letting things play out to the bitter end. The question is would you rather have them go out a day early or a day late?
Hmm.
I think as people, I think empirically, most of us would say we'd all rather go out a day early. Um, and that's a very easy conversation to have when it's not real.
Yes.
But then when you start talking about an actual life, it becomes a bit more of a difficult thing to think about. But what I can say is that, clearly, most people's natural tendency is to drag things on a little further than they should, because understandably we don't want to let go. That said, after about 20 years of being a veterinarian, what I can tell you is that 6 months or a year or 2 years down the road, when you talk to people that have been through that, it's not uncommon for me to hear people say that in hindsight, looking back on it, they waited too long. I've never heard somebody come back to me and tell me that in looking back on it, they did it too soon, because it's just not our natural tendency to do so. But
Yeah.
at the end of the day, it's an agonizing decision to make. I mean, I've made it for my own personal pets, and I totally feel for anybody that's going through it. And it's just something that if it's at all possible, you just try and make the most logical, the most sensible decision that you can in the moment.
Do you think that you should treat cancer in pets like we do for humans?
Well, I think it very much depends on exactly what's going on. I mean, so clearly, cancer is sort of the pinnacle of the worst things that
Sure.
that animals or people can get. Um, that said, uh, one of the upsides of dealing with an animal that has a diagnosis like cancer is, as long as they feel good, they don't care. One of the things I frequently remind people is that your dog or your cat, they live for the day.
Mhm.
They wake up in the morning, they take stock of what they have, and they move on. Never has there been a dog or a cat who formulated the thought, why me?
Right.
Self-pity is not in their repertoire. So because of that, even though they have cancer, from their perspective is fine. As long as we can keep them feeling good and their quality of life is good, even if we know that it's a fairly short term, I think that's absolutely fine. And if there are medical therapies, and whether or not that's something on the more natural medicine side, or chemotherapy, surgery, radiation, what have you, if there are medical therapies that can significantly improve or maintain quality of life for a period of time, I think those are absolutely worth looking at and worth discussing. Clearly, everybody needs to make a decision about what
Sure.
they feel is right for them. But I think that those options are out there for us, and I'm always a big proponent of people making an informed decision. So I always tell people, get all of the information you can, and then make your choice. So that way, at least you know what all your options are.
Yeah. I think one of the hardest things for me that I hear, and a lot of people experience, and it's not your fault at all, is just the cost of care, you know, is my dog I have to put him down because I can't afford the treatment,
Sure.
which is very heartbreaking to hear. Just this week, I posted on Facebook. My son's friend came to me and said, "Can you help? Can you help my dog? He was a rescue, and his molars were." And this one vet said, "He's got sepsis, and his teeth have to go, and all this." And then I said, "Would you please just take him to my vet, because I don't know. Like, I think that it's not quite right what they're telling you, and the $4,000,
Mhm.
$5,000." Bill that they said might be more than that. He did, and my vet said, "You know what? He doesn't have sepsis, and he doesn't have that, and any vet can do this, and I don't understand why he would send you to a specialist," and yada yada yada. So how do you know? How do you know when it's right? I mean, insider information maybe, but it's difficult. And this was a young family with two little kids, and I thought, why would you do that to this young family? Like, maybe he didn't know, but I think he did know.
Well, I mean, obviously, I don't know about
No, you
that
don't.
situation specifically, but what I can tell you is that just about every veterinarian that you will ever run into is doing their job with sincerity and from the heart. That's not to say that veterinarians are sometimes not wrong.
Right.
Just like physicians are, sometimes wrong. I mean, misdiagnoses get made. People make recommendations that, even though they're made with the best of intent, maybe aren't the best thing out there. So for starters, I think whenever somebody hears something from a medical professional of any kind that maybe doesn't sit quite right with them, get a second opinion. Um, you know, there's no downside to getting a second opinion. Either the second person is going to agree with the first, and you'll have confidence,
Right.
or you're going to get some better information out of the second person, and then you can make a different decision. So, I mean, I
So you
think
don't
that
mind
comes.
if somebody comes and asks you that?
Oh gosh, absolutely not. My feeling has always been there's really no room for pride in medicine, and if there's somebody out there who can do a better job than me, then by all means, I'm going to send you to that person.
I think you're an extremely special person. I really do. You
Well,
are. You are unique unto yourself. Let's talk about the different breeds for a moment, because I've got a golden now, and I know that goldens are prone to cancer. And mine doesn't have cancer, thank God, knock on wood anyway. But he is a very old soul and always has been. And at 5 years old, he's getting all gray. It seems to me he's like in an accelerated aging for some reason.
uh-huh.
First time I've ever had this breed. But I think that there are breeds that certain things are common to them.
Sure.
Uh, and so let's just talk about that for a moment. Boxers have certain things, and different
Mhm.
breeds have different things. So large and small, little dogs tend to live longer.
It's a bit of a generalization, but yes, smaller dogs have a tendency to be a little bit longer lived than the larger dogs, and certainly the really big dogs, Great Danes, Mastiffs, these sorts of things, they do tend to kind of go on the shorter side.
So why is that? Like,
I mean, it's a lot to do with metabolism and just stress on the body.
okay.
Interestingly, from a from a genus and species standpoint, you know, a miniature poodle is the exact same species as a 200-pound Great Dane. You know, they're almost genetically identical. But at the same time, you could imagine that there's a lot more stresses put on the body. You know, I mean, you know, think about it from the standpoint of like, you know, your average 5 foot something person, and then you take somebody who's 7 feet tall and weighs 350 pounds. That person has a lot more stress on their body, on their bones, on their joints, on their heart, and it just has a tendency. It has a tendency to wear on you, and that in some cases will lead to a shorter lifespan. That's certainly not to say that there aren't a lot of things that we can do from a preventative standpoint to really lengthen these guys' lifespan. It's just a lot of that takes a preemptive effort. If we wait until they're sick and they're having problems, then in many cases we're already behind the eight ball.
Yeah, you know, when I was reading your book, and especially the nutritional, you know, section, which I really want to delve into with you, one of the things that really hit me was my dog he's about 110 pounds, and he's very big. He's always been a very big golden. He's bigger than most of the other goldens that I see, but they tell me he's a little overweight, and I've had him on diet food, fish, you know, which is not that healthy now that I read your book. And I thought, yeah, I mean, I knew that, but it didn't hit, right? I'm going, oh, but it's whitefish from Northern Ontario. It's probably okay, you know? But so let's talk about the diet in the larger breeds to start with. What can we do to keep them healthy? What should I be feeding? And what should they look like? Should he have his ribs showing?
Right, right. So, yeah, I mean, for starters, 110 pounds is a big golden.
He is big.
Even if he is a little overweight, that's a big dog for a golden, just in general. But I think the way to begin to look at nutrition in any animal, in any person, is, for starters, you know, we want our pets to eat as close to a fresh whole food diet as possible. So, you know, that's not any real controversial or groundbreaking statement. I mean, I think that we all know for our own health that we should not be eating highly processed foods, and the more fresh fruits and vegetables and things that we're eating, the more healthy we are likely to be. And that is absolutely the case with dogs and cats and any animal. I mean, if you think about it, I mean, our bodies are the way that they are because this is how we evolved to be. And nobody evolved eating food out of a bag or out of a can.
True.
So that's where we have to start when it comes to pet food. You know, the bottom line is dry dog food and canned dog food only exists for one reason, and that reason is our convenience.
Right.
You know, it's definitely not what you know we would describe as ideal nutrition. So that's where we want to start, is fresh whole food diets. So a fresh whole food diet for a dog or a cat, there's a number of ways that could be accomplished. These days, there are quite a few companies that are making fresh diets. So it could either be frozen, something that you buy frozen raw food, frozen cooked food. There's companies now that are taking fresh food diets and then they're freeze drying them. So at very low temperatures, they're basically sucking the moisture out of them so that they're shelf stable. So that way you don't have to worry about freezer space, but those diets are still very, very healthy. And then to go one step further, if people are so inclined to do it, you can also make food for your pets at home. You know, you absolutely can cook for them at home. The one caveat is if you're going to make food at home, it's really important that you work off of a properly balanced recipe so that over the long haul, you know that they're getting all the nutrition that they need.
That's the worry. And how much do you give them?
Yeah. And, you know, I mean, you absolutely can calculate, you can do the calculations of how much you need to feed them based on calories. And I'm sure you saw that in the book.
Yeah.
But you know what? I mean, at the end of the day, if you're not somebody that wants to do all that math, honestly, feed them what looks right. And if they're gaining weight, feed them less. And if they're losing weight, feed them more. It's, you know, it's just that, it's really just that easy. You don't have to make it a science project, you know, unless you're just that kind of, you know, precise person. But yeah, like I say, I mean,
what about picky eaters?
You know,
I have the pickiest dog in the world.
Sure.
Like, honest to God, you know, you give him a cookie. No, he's not going to eat a cookie. He is
Yeah.
not going to eat. Pork gives him diarrhea. I know that because I've
Hmm.
given him a little piece off my plate.
Sure.
You know, he's not going to, people go, he's not going to eat that. No, he's not going to eat that. He's just
Right.
like turns his nose up at everything.
That's a
So
very unusual golden retriever.
he is. And I
Yeah.
see, you know, my son's dog, you know, carrot, you want carrot? You want a celery? You want this? You want that? He'll eat
Yeah.
garbage eaters. My Chihuahua is walking around. She's like a Hoover vacuum.
Uh-huh.
Whatever falls on the ground. But he's got a
Sure.
very delicate stomach, always has. Used to get
Right.
diarrhea all the time as a puppy until
Hmm.
I found a food that, you know, eventually it was Fromm's, what seemed to be the only thing he could keep in him.
Hmm.
But, you know, he does love sweet potato and he loves squash.
Okay.
Absolutely loves like that turban squash. He would eat
Uh-huh.
that every day. So,
Right.
you know, what do you feed him?
Well, I mean, the good news is if we're once we start looking at these fresh whole food diets, one of the first things that people find out is that those foods tend to be really, really palatable. I mean, that's not super surprising. I mean, if you look at a plate of fresh food versus, a pile of little brown nuggets that came out of a
Mhm.
bag, I mean, again, I mean, you don't have to be a nutritionist to figure out which they're more likely to go for. So most dogs and cats really like fresh food, so that's a big plus. And then, for the ones that have sensitive stomachs, interestingly, sometimes they just flat out do better on fresh food because a lot of things happen when food is processed that actually can cause problems digestively, as opposed to fresh food. And secondarily, if a dog like your dog legitimately has some dietary sensitivities and some dietary issues, then it may be just a function of figuring out what the right combination of nutrients are for that individual. So, for example, in your case, perhaps pork is not the way to go.
Right.
But if he does okay with, say, beef or chicken or lamb or whatever the protein may be, then that's perhaps a better way to look.
And should you like switch it up?
That's a great question. I mean, I think in a perfect world, rotating through foods and rotating through proteins is a really good thing because it's going to give them a different spectrum of nutrients. Again, if we look at the way dogs and cats and people were evolved to eat, certainly none of us evolved eating the exact same thing every day for the long term. So, if you have a pet that is fine with you occasionally rotating their food through, I think it's a really, really good idea. There are animals out there that have such narrow dietary restrictions because of sensitivities that sometimes that's tricky. And in those animals, if even if you can't do it, then so be it. You're still feeding them a really good quality fresh food diet. But if it is possible for people to rotate through proteins, rotate through ingredients from time to time, that could only be a good thing.
Like I noticed that you one of your recipes has quinoa. So you
Uh-huh.
give them quinoa
Yeah.
and is that a protein?
That's a good question. It's a little bit of both. I mean, quinoa clearly has protein in it. It also has really good complex carbohydrates in it. I think in the technical scientific sense, quinoa is not a grain. But that brings up a point that there's a lot of talk in the marketplace now about grain-free foods, grain-free this. I think grains have somewhat been demonized a little bit in the market because it was a good PR move. It's not that grains are by definition bad for dogs. Certainly, what we don't want to be feeding them is a lot of high carbohydrate and simple carbohydrate foods. So, like white rice or corn or wheat or these sorts of things, because that's just a lot of empty calories per
What
se.
about avoiding soy? Should they avoid soy too?
Again, I mean, soy as a food ingredient is not in and of itself a bad thing. But one thing that I would say is, while every ingredient in dog food absolutely does not have to be meat based, I do feel very strongly that their protein should be meat based.
Okay.
So dogs that are using soy or dog food using soy as a protein source, unless there's a very specific medical necessity for that, that's not a direction I would normally choose to go
Now
in.
I know that you said that you liked the raw diet, that you thought dogs really thrive on it. And I
Yeah.
did try to give my dog raw food, didn't
Uh-huh.
like it at all.
Okay.
And but I know people who are giving dogs like chicken carcasses within the bone and everything it's
Sure.
all there, right?
Uh-huh.
Um, but then the new vet are going, don't give them bones. They get splinters in their throat. Oh my God. Like, oh my God.
Right.
And my dogs have always had a bone their whole
Right.
lives, 50, 60 years. I've had dogs,
Yeah.
they've had bones and now they're not allowed to have them. Is it like a case of something
There's
happened to one or?
there, there's a there, there's some controversy within the veterinary field as far as raw diets go. Many veterinarians would advise people against feeding raw diets. In truth, there's not a lot of science behind that position. Clearly there are concerns about raw meat and bacterial contamination and that sort of
That's
thing.
about the only thing for me that.
Yeah, I mean, and the two things that I would say to that is number one, um, dogs and cats tend to be way more resistant to bacterial contamination than we are. So they tend to do okay with it. And secondly, when you look at some of these well-made, commercially prepared raw food diets, they are made so well that they are literally certified pathogen free before they leave the manufacturing facility. So in truth, that raw meat that you buy in the pet store for your dog is far safer than that package of chicken that you buy in the grocery store, which is almost guaranteed to be covered with salmonella and E. coli. So in that sense, dogs, many dogs do great on raw food. It is not by definition the end all be all. That's what you have to feed your dog. There are a lot of dogs that do great on cooked whole food diets, and that's absolutely fine. And to answer your question about the bones, my recommendation for people with bones is I don't have a problem with people feeding their dog bones, but they should be raw bones. And the reason why I say that is raw bones are softer and the dogs can chew through them. So what will happen is as they're chewing through them, it's actually cleaning their teeth. But the bigger concern is, like, for example, when you go to the pet store and they have like all those bones like sitting in the bin, those bones are cooked, and cooked bones are incredibly hard. And it's very common to see dogs who have broken teeth from chewing on bones, and then you have to go pull teeth and and everything that comes with that. So if you're going to give a dog a bone, it's far better to give them an appropriately sized raw bone. Let them crunch through it and eat it. They can
A marrow bone.
solve it. Yeah, it's fine.
That's fine.
And like I say, it'll keep their teeth clean in addition to everything else.
Well, I want to talk about teeth for a moment. One of the thoughts, my stepson has a little chihuahua, and he goes, well, I really like her to have, the hard food to clean her teeth, because she doesn't really, if you're only eating soft food all the time, what are you cleaning your teeth? Now, do we have to brush our dog's teeth?
Sure. So, if somebody could make a single argument in favor of dry dog food, that might be the one, is that it keeps their teeth a little cleaner than if they were eating like a fresh food or a canned food diet. That said, relying on food to keep our pets' teeth clean is just an inadequate sort of step to make. And all of the other myriad health reasons that make fresh food better really outweigh that. So to answer your question, in a perfect world, yes, we all should be brushing our dog's teeth. Again, in a perfect world, it should be done on a daily basis. So it takes about 48 hours in a dog for plaque to mineralize into tartar. So technically speaking, if you're brushing their teeth every day, then you're really going to keep the tartar formation to a minimum, and you're going to keep their gums healthy. But again, living in the real world, I fully understand that not everybody is going to brush their dog's teeth, and I fully understand that not every dog is going to let you brush their teeth. So there are lots of other things that can be done. We were just talking about raw bones, so maybe a raw bone like once a week to help them clean their teeth. There are additives, like all natural additives that you can put in their drinking water, that can help reduce the amount of plaque and tartar. Under the right set of circumstances, a non-anesthetic dental cleaning can be beneficial for dogs, but I want to really stress that it has to be the right circumstances. It should be done under veterinary supervision. This is not something that should get done in a pet store or a grooming salon. And not every animal is a candidate for a non-anesthetic cleaning, because at some point they very likely are going to need the full anesthesia procedure with the dental x-rays and the deep cleaning and everything. But using a non-anesthetic cleaning as part of a larger dental care plan can be very beneficial for these.
So should your dog have a deep clean once a year or something, or?
It very much depends on the dog. I mean, most dogs certainly would not require a full anesthesia dental cleaning on an annual basis, unless they're just one of these unlucky souls that just genetically have terrible teeth. But you know, how frequently a procedure like that needs to be done certainly has a lot to do with what they're eating, what sort of preventative care people are doing at home, and to a certain extent, just their genetics, because just like with people, some dogs just have worse teeth than others.
Yeah, yeah. Which brings me to one more. I was just thinking about, don't do it in a salon. What about the anal glands? What is it about the anal glands? Do you have to express them? Is this something that's for real or what?
Well, I mean, you certainly, so anal glands are clearly a real thing. I mean,
Yeah,
you know,
of course they
evolutionarily speaking, it's a scent marking organ, so that one dog knows what other dog came there before them. Um, the large majority of dogs, their anal glands are sort of a no maintenance kind of thing. They just deal with it on their own.
Mhm.
Every now and again, you'll get a dog that might get an anal gland impaction or an anal gland infection, and that becomes an issue that needs to be dealt with. But you know, my personal feelings as far as anal glands is it's one of those, if it's not broke, don't fix it kind of things. Because if you are expressing or squeezing their anal glands frequently, potentially you're going to cause irritation and inflammation, and maybe that leads to a problem. So if
Mhm.
they're not having an issue with it, I would suggest people just leave it be.
When they're scooting their bum, is that just their
That
itch?
can be an indication of an anal gland issue. It's not. It could also be allergies. Depending on where you live, sometimes that's also a sign that they could have some sort of parasite like worms or something. So that's definitely something to check with your veterinarian about.
So let's go over the signs of stress. I was reading an article that
Mhm.
the other day that I didn't know this, that when your dog licks its lips, it's a sign of stress.
It
You think
can
that
be.
can be?
Yeah. So I mean, dogs and stress. I mean, it's interesting because there's a lot of parallels there to people, in the sense that some people are just naturally more high strung than others. Same thing goes with dogs. Some of that varies by just individual personality, although without a doubt, some breeds tend to run more high strung than others as well. But dogs can manifest stress in any number of ways. Ranging from, as you say, sort of licking behavior. There's separation anxiety with dogs, so dogs that completely freak out when people leave them at home alone. There's dogs that don't do well with strange people or with dogs they don't know. So it's incredibly variable from one individual to the next.
Well, let me tell you about the dog that can't be home alone. My other son has a dog who cannot be home alone. He's a Shepherd
Uh-huh.
Husky mix.
Uh-huh.
And ever since he was a puppy, they tried to crate train him,
Yeah.
and he got his head stuck in the bars when he was a puppy, and
Yeah.
his mouth was bleeding. And so they said, okay, well, that's probably not a good idea. But they got him another crate, and they got him another crate, and then they finally left him alone. And they've done the lavender coming out. They've done all kinds of, the thunder shirts. They've
Yeah.
done just about everything that you can think of. And then a couple weeks ago, he decided that he was going to get into the freezer now, and he opened up the freezer door, took out all of the meat, took shrimp, spread it all over the bed. Every day he takes his shoes and he brings them up to the bed. He spreads all the clothes and does this whole thing.
Okay.
Unbelievable. He's so smart. Okay.
Yeah.
So they said, okay, that's it. We like every day he wrecks a trim. He does like hundreds of dollars worth of food. So apparently there's a crate that's supposed to be for really high anxiety dogs that they cannot hurt themselves. They can't get out of this crate. It's very, very expensive. My son bought this crate. The first day he put the dog in the crate. They started training him every night to go in the crate and just sit there with
Uh-huh.
food or whatever. But then the first day they actually left him there when they went to work,
Yeah.
he broke his eye tooth out. So he
Right.
just had surgery and had that removed a couple of days
Sure.
ago. So they had started to give him a spray and other things, because they're going like, we have to leave our dog. We have to go to work. And they
Uh-huh.
love their dog and they don't want to put their dog down. He's only, 4 years old.
Sure.
But you can't have your home destroyed and your food destroyed every single day.
Clearly
So,
not.
yeah. Okay. What is there another step that they could do?
Yeah, there's a number of things, and I think whenever you look at sort of like an anxiety issue with a dog, again, it's sort of beneficial to think about it through the lens of a person with an anxiety disorder. So, I mean, when we look at the things that we do for people with anxiety disorders, you know, there's medication that
Yes.
people can take, and certainly there are medications, both natural and pharmaceutical, that you can put a dog on to help with anxiety. But it's really important to remember that you are never going to be able to purely medicate this away.
And you
Uh,
don't want to have your dog medicated all day. You don't want
well,
to
yeah, I mean, the
stoner.
goal, obviously, you don't want them. You don't want them just sedated. But like, again, I mean, if you look at a person with an anxiety disorder, there's no pill that's going to fix that.
Yeah.
Um, what is going to get that person or that dog the farthest down the road, is going to be therapy. So therapy for a person, some sort of behavioral training, for a dog, because what we want to try and do is start to desensitize them to the triggers, that get them in a panic. Because the problem is once they're in a panic like that, there's no stopping it.
Yeah.
It's kind of like if you've ever had an experience with a person having a panic attack, you cannot talk that person down from that. That's it's done at that
Yeah.
point.
Yeah.
And it's really a tricky thing. And separation anxiety is a very, very difficult issue to deal with. But what you can't do is you can't just push them through it and hope they just get over it. So I mean, the advice that I would give to somebody would be, definitely work very closely with a trainer. Definitely talk with your veterinarian about whether or not there's some sort of either medication or supplement that can
Yeah,
be.
they were giving him a medication. I can't remember what it was, but I know that there was a spray that they had to do every night, and there was
Uh-huh.
it wasn't Valium, but there was something that they were giving him, and it did
Sure.
seem, they said it did seem to he seemed calmer, and that's
Yeah.
when I thought we can leave him in the crate now.
Yeah. I mean, the best thing that you can hope for with medication is that it calms them down to the point where they can start to accept and listen to training, rather than just being in a total panic.
One trainer said to have a collar on that shocked them when they started to cry or yip or whatever,
Yeah.
just to shock them out of the behavior. But they were worried that he would
I
be
don't
doing
think
it so
that's going
much
to
that
work.
they'd be like doing it all day
Yeah.
long and be shocked all
I
day.
don't think that's going to work. Yeah.
Yeah,
I
I didn't
mean, the
like that
other
idea.
option, the other easy option is depending on where they live, if there's like some sort of like daycare service or something that they can take the dog, and that way the dog can, instead of it being a terrible thing, when they go out of town, now the dog gets to go play with other dogs, and all of a sudden it's fun.
Yeah, I mean, he goes to daycare once or twice a week, but they can't afford it. They're a young family having kids, just the first
Sure.
baby, so they can't really
Yeah.
afford daycare every day. But
Right.
when he is well exercised, and they tried to do the treadmill
Mhm.
before they go to work, right? Because
Right.
he got scared of it. He didn't want to go on it.
Sure.
But that's another story. But I just wondered if there was something else for them, because he is a beautiful little dog, but he's destructo.
Yeah, it's tricky. Those are real tough to deal with.
Yeah.
Yeah.
Okay. Wow. Let's talk about cannabis. Is he a candidate for cannabis?
He very well could be. I
A
mean,
CBD?
just like with people who have anxiety, PTSD, what have you,
Hmm.
cannabis can be a very, very beneficial part of kind of a larger medical plan. So yeah, I mean, if we're classically speaking, if we're looking at stress and anxiety, you're looking at a kind of a more CBD dominant, sort of preparation. But yeah, there's just an incredibly wide range of medical uses.
So in the veterinary industry now, there is a cannabis. They would get a prescription for cannabis. Your dog, let's say, is that, or how is it administered, through oil or
Well, generally speaking, usually it's done either as a liquid, like an oil, or there are companies out there that are making like treats that
pellet?
have
Yeah.
CBD in them, that sort of thing. But as I'm sure you're aware, I mean, cannabis on a federal level is still illegal, so nobody can sort of quote prescribe cannabis per se. And honestly, here in California, there is a very, shall we say, lively debate going on right now, about the veterinarian's role as it pertains to medical cannabis. So we're in a funny spot right now in California where our veterinary medical board here has told the veterinarians in the state of California that if we recommend cannabis for our patients, we put our licenses at risk.
Wow.
But the flip side of that, of course, is that as of January 1st in California, cannabis is recreationally legal here, which means anybody over the age of 21 can buy it. There's more and more products coming out on the market that are specifically labeled for pets. And we're in this kind of funny situation where the only people in the entire state that are forbidden to give you as a pet owner advice are the veterinarians.
So you're gonna blow smoke into your dog? Is that
So
what
it's kind of a nutty thing, and what you wind up with is people who are being forced to get medical advice from somebody that works in a pet store, somebody that works in a cannabis dispensary. It's a ridiculous situation.
kind of scares me? Like one of my sons said, "Oh, I think it'd be really good for my dog." I got a lot of kids, and I go, well, I don't know. Like, how would you even know how much they could have? Like, what if they went on some weird trip? I don't know. It kind of bothers me a little bit. Like,
Yeah, I agree. And that's the thing. I mean, to me, I look at cannabis like I would look at any other medication, in the sense that if we're going to be safe and we're going to be effective, then we need to know exactly what we're giving, and we need to know exactly what dose we're giving. It's not just just give them some of this and see what happens. It is, as I think there's a misconception that cannabis is a completely harmless thing.
yeah.
And to me, it seems like you have people simultaneously making the argument that cannabis is completely harmless and cannabis is this unbelievably effective medicine. And to me, I don't think that those two arguments can exist in the same space. If it has profound physiologic effects, then there are going to be potential downsides if it's done improperly.
I can tell you from my own, because I do suffer with severe chronic pain. I had a prescription for cannabis, didn't do anything for me, nothing. So you know what, like it's going to be individually based anyway. I did see treats with CBD at the pet store the other day. I live in Canada, and I did see some treats in there. The bag was about $19 for a little bag.
Yeah.
Yeah, I was quite surprised to see it. And I was, because your dog could be any size. Like, how do they know?
I would agree. And that's why literally just in the past week, we've begun the process of getting a bill entered into the legislature in Sacramento to pass some legislation that would allow veterinarians to be part of this discussion without having to fear for their licenses, because the situation as it stands right now is that there is no guidance for people, and it's a very dangerous landscape.
What's happening with the vets in Colorado?
So it's interesting. As you're probably aware, I mean, there's 29 states in the U.S. that have cannabis laws of some sort or another, except for some reason that nobody's ever explained. California is the only state that I'm aware of where the Veterinary Medical Board decided that they were going to let veterinarians know that if they uttered the word cannabis in front of a pet owner, they were going to get themselves into a lot of trouble. So most of the other states, all of the other states, they're just letting veterinarians do their job and be veterinarians, which is, in my opinion, what they ought to be doing. But because our Veterinary Medical Board took the stand that they chose to take, now we're in this position where we have to take some sort of legal action to fix
So
it.
Surprising from such a liberal state.
Right? One would think.
Yeah,
Nobody,
one
like I
would
say,
think.
nobody has been able to explain this one to me.
Wow. Well, they're doing the same thing here in medical care with, telling doctors that they can't prescribe narcotics anymore or whatever, and not allowing them to use their brains or whatever else and their knowledge to say, you know what, I think this person might need something.
Agreed.
But, you've got people who don't have a medical license making these rules. So a lot of times, right?
That is often the case. You have people who just don't understand how this works.
Yeah.
And they're making the rules. So we're working on getting that fixed.
Wow. That's crazy. Your book,
Yes.
beautiful book, fantastic book.
Thank you.
Covers the gamut, really does. I think. What else is in that book that we should talk about? Let me look at my notes here for a second, but maybe you can. You're probably a lot more. I only read it once. You've read it 1,000 times.
About 1,000 times, yeah. So the way that I sort of approached writing the book was I wanted people, number one, to have a really good understanding of nutrition from the perspective of both preventative nutrition and therapeutic nutrition. So how to keep your pets healthy, and if they do have some sort of illness, how to use food as medicine.
Yeah.
So that was really step one. And then step two was to introduce people to the concept of integrative medical care. So so how do we take the best that Western medicine has to offer and the best that holistic and alternative medicine have to offer, and combine those two things together to get a greater effect than the sum of the two.
Yeah.
So what I did was, is after introducing these topics, I went through just about every major medical condition and body system that I frequently see problems with in my office: kidney disease, liver disease, diabetes, cancer, et cetera,
Yeah.
and laid out for people, how are these diseases diagnosed? How are they treated from a Western medical perspective? How can they be treated from a natural medicine perspective? And how to integrate everything together. So if you, for example, have a dog that has liver disease, there's a whole chapter in this book that's going to give you a roadmap of what to expect, what to look for, and what your treatment options are.
Yeah, I think you did a really good job there. And I think it's really important because you didn't throw the baby out with the bathwater on Western medicine. And you said, you know what, there's a need for Western medicine, and then there's a need for Eastern, or, natural medicine. And,
Sure.
and, if your dog's got this, he's going to need this kind of medicine. And if you've hit that road,
Yeah,
let's go over here and see what's going to happen. Because I think sometimes people get so, oh, it has to be natural, that
sure.
they may not be getting the best benefit if they had gone the other route.
Agreed. And I'm a huge fan of Western medicine. I mean, I practice it every day, because the reality is that there are things that Western medicine can treat that natural medicine cannot, and vice versa. What I frequently tell people is, if you're walking across the street and you get hit by a bus, you do not need an acupuncturist in that moment.
Right.
If you're still around a few weeks later, then probably an acupuncturist would be a really wonderful thing. I think the wonderful synergy about all of it is the places where Western medicine falls short and does not have options are frequently the places where natural medicine shines.
Hmm.
The Western medicine has problems with chronic disease. Where as Western doctors, we're really good at treating infection and trauma and broken bones, and if something needs surgery, we're really good at that. But when you start looking at things like chronic inflammatory disease, chronic pain, things that just nag and won't go away, that's where Western medicine doesn't really have a whole lot of good options, and that's where natural medicine just absolutely shines. So there's this beautiful integration between the two, as long as people are willing to just look at both sides of the coin.
How many practices that you know of have a hyperbaric chamber?
Uh, I mean, I would guess that there's probably, across the country, I would say, give or take 50, maybe.
Really?
Yeah, I mean, not a lot,
Yeah.
not a lot, and most of them are on the East Coast.
Yeah.
Yeah.
Yeah. And you would use that. I have a friend actually in England who's getting treated with hyperbaric medicine. But what would you use it for?
So we use hyperbaric oxygen for a number of things. Sort of its more conventional, traditional uses would be for chronic non-healing wounds. It can be very, very beneficial for some sort of really severe inflammatory condition. So whether or not it's like spinal trauma, brain trauma. We once treated a dog that had a black widow spider bite, that responded very well. We don't have a whole lot of venomous snakes out here where I live, but there's a lot of case reports of animals being treated after snake bites that have done extremely well. And going beyond that, there are other potential benefits of hyperbaric medicine that maybe go a little bit outside the conventional therapy perspective. There are some protocols looking at treating cancer, using not hyperbaric medicine alone, but as part of a larger treatment protocol. We can use it for animals that have gastrointestinal issues, that have liver problems, just about any any medical condition that would be described as having, as partially being caused by either poor circulation or poor oxygenation of the tissues is very likely to respond well.
How alike are we? Like, I mean, they say dog and human, let's say, they say with cancer that if you want to try to have a more alkaline than acidic,
Mhm.
blood and stuff like that. Would the same be true for a dog?
On some level, yes, the same is true for a dog. I mean, cancer pathology in dogs is not dramatically different than that as it is in people. Realize that, dogs and cats clearly have a different nutritional profile than people do. So, I mean, dogs, they're much more sort of carnivorous than we as people are. So their diets tend to be a little bit more acidic naturally, whereas we as people are designed a little more towards alkaline. So there are some differences there, but I mean, that certainly does come back to the earlier conversation about nutrition. Because I mean, if you're worried about body pH, then really what we need to be talking about is food.
Yeah. I mean, when your dog goes and eats grass, long grass, not grass. My dog likes long grass. Does that mean that their stomach's upset or they dislike
There's
grass?
a number of possibilities. I mean, they will sometimes do that if they have an upset tummy. But conversely, so for example, here in the San Francisco Bay Area right now, it's getting around springtime and there's a lot of new grass coming up, and a lot of dogs find that fresh spring grass is just irresistible. I guess it tastes really good if you're a dog. And some dogs, quite frankly, are just grazers.
Yeah.
Remember that. I mean, dogs are omnivores. I mean, they definitely lean towards being carnivorous, but they are omnivores by design. And so eating grass on some level is a natural behavior for them.
I went into my dog's daycare the other day, and there's a big salad sitting there in one of the windows, and somebody sent their dog lunch, and it was salad. And I'm like, are you kidding me? Literally, it was cucumbers and lettuce and tomatoes and all this. And
Sounds
yeah,
good.
that's what she sends.
Yeah.
I'm like, wow, my dog wouldn't eat that in a million years. I couldn't
Right.
get that in him.
That's
No way,
funny.
no how. No matter how hungry he is.
Awesome.
Yeah, I think it's pretty cool when they do it. But I don't know. Wow, that's fantastic. And I put the video of Starfish up on the Good Radio Network site, and just tell the folks here about Starfish and the treatment that you gave, because I think it's just an absolutely beautiful. It just shows how far you're gonna go.
Sure. Yeah. I mean, Starfish is a great example of how complementary care, you know, literally saved a life where Western medicine, had nothing to offer. So Starfish was a puppy that came to us who has a condition called Swimmer's syndrome. Swimmer's syndrome is a little bit vague in its causes, but it's a developmental abnormality where essentially the her legs were all sort of splayed out to the side, and she literally just could not get her legs underneath her to stand. So hence the name Starfish, because she was, but so it was kind of adorable.
It is.
But anyway, this dog was rescued from the shelter, and the rescue group initially took it to an orthopedic surgeon, a surgeon that I know very, very well, have worked with for many years. She's an outstanding surgeon. And I later talked to her about this on the phone, and she told me that she was literally holding Starfish in the palm of her hand, little tiny dog, holding this dog in her hand, looking at it and trying to decide whether or not she should send it to our hospital or just recommend that they put the dog down, because she honestly, in her heart, believed that it was hopeless. And mind you, again, this is an excellent surgeon and somebody that I've worked with for years and years and years. And ultimately, she decided to just send it. And she sent it to us. She sent Starfish to us, and we began a course of physical therapy, basically, of doing various techniques, many of which you can see on the video, of ways that we sort of got her legs underneath her and helped her start building up strength. And literally within a matter of weeks, this dog was walking. And at this point, now that it's unbelievable. And now that we're a few months down the road, like if you saw this dog walking down the street, if you were really observant, you might notice that her gait is a little off. It's not exactly perfect, but at a casual glance, you would never know. The only thing that would strike you is she is an absolutely stunning dog.
She really is.
She's a beautiful, beautiful
dog.
dog. But yeah, I mean, that's a, this is a
What percentage of dogs, like I've never heard of this. So what percentage of dogs
it's
are
pretty
born with this?
uncommon.
Is it?
It's not something that you see very frequently. Although I will say that animals that come to us who have zero treatment options from a Western medical standpoint, and we're able to make them better, that's actually quite common.
Yeah.
That we see a lot.
So in your head, you never treated this before.
No.
But you heard about it and your brain just starts going, I think I can do this and this and this, and maybe we can do that.
Sure.
That's
Yeah,
phenomenal.
exactly. I mean, you start thinking about, okay, what can we do to help this dog? I mean, I had the great benefit of one of our canine rehab technicians she's just an unbelievable wealth of knowledge and experience. And she had a lot to add to the discussion. And she had treated a couple of swimmers dogs in her past. And like I say, we were just able to put together a regimen for starfish, and literally could not have worked out better.
That's like the best story ever. I just love it. And I just love it that, you will go to the ends of the earth to help these animals, and that's phenomenal. Just before we go, tell us about the nonprofit.
Sure. So our nonprofit, the Pet and Wildlife Fund, we started that quite a number of years ago as a means of raising money, both to help injured and orphaned wildlife, and also to help rescued pets in the Bay Area. The Bay Area being a fairly population dense area, we do have a lot of orphan pets, a lot of animals that need rescue, and we do see some of them come through our office, and in part because of the Pet and Wildlife Fund, we're able to provide those animals with the kind of medical services that they really need at a discounted price for the rescue groups. So that's it's one of those things from a standpoint of community involvement. It's really important for us as an organization to be a member of our community and to do everything that we can to give back. And fortunately, we've had a lot of opportunity to be able to do that.
I don't have another hour to list all of the boards and societies that you belong to and that you help with. And I mean, like, it's just, you're like got a list like this long. It's fantastic. Congratulations on that.
Thank you.
Your book is called The Ultimate Pet Health Guide.
Yep.
Go to Amazon and grab yourself a copy if you're a pet owner, because it's fantastic, and it's a real Bible. Like, it's really a really great book to have.
Thank you.
Your website, tell folks how they can reach out to you.
So the website, if you want to learn more about the book, the website is drgaryrichter.com. If you want to learn more about holistic medicine in general, you can go to holisticvetcare.com. And I'll also just say that if you're a person who has strong feelings about medical cannabis for pets, and or you've had experiences with your own pet with cannabis, and you'd like to sign a petition in support or write a testimonial about how cannabis helped your pet, you can go to holisticvetcare.com, and right at the top of the page, you'll see what to do.
So you're needing people to sign a petition. I'll put it
Please.
on our website. Definitely.
Absolutely.
We'll do that.
Thank you.
Yeah,
Thank you.
no worries. Anything for the animals.
I appreciate it. Thanks.
I got a mug just before. I got a mug the other day, and it said, "I don't care who dies in the movie, so as long as the dog lives." That's my motto.
There you go. I agree.
Thank you, Dr. Gary Richter. Thank you so much for being my guest today. Thanks to each and every one of you for stopping by and listening to us. And for those who are going to listen later on, it's a great show. You're going to enjoy it. Take care.
Thanks so much.